let's get going with a few attempts to sort of situate us with basics. Okay, and we're going to be covering here, and this is partly responsive to particular needs in the attendees identified. We're going to be spending a brief time trying to provide an introduction to and motivation for this sort of system science, and then looking at briefly at the three types of dynamic modeling that any logic supports. Okay, and here we're going to be giving sort of a whirlwind set of motivations. These are areas where I've talked about in more detail online. Suffice it to say that we increasingly live in a world that's confronted by a variety of complex and health challenges of significant current and growing complexity. These are challenges that are multiple in nature. They include the graying of the population and the heavy burden of comorbidities increasingly seen. They also involve a distressing number of what are called syndemics, where some of the same communities are burdened simultaneously by high levels of chronic disease, communicable disease, and in some cases real severe social problems, including things like substance abuse, domestic violence, crime, poverty, etc. And Merrill Singer, in his book Syndemics, which is a wonderfully thoughtful book that Kurt should read soon, has characterized this notion of a syndemic. These kind of mutually interacting conditions, often spanning the health and social areas that exist in this very tangled form. An example of this would be substance abuse, violence, addictions, and HIV infection. Another one would be interactions between chronic and communicable diseases, say between obesity, H1N1, or likely between diabetes and tuberculosis. There's a lot of entanglement of social and health issues. We're also living in a world that, not geographically, but in terms of its, in terms of the effects, is increasingly small. And here on campus, we're very fortunate to have a One Health initiative in which many of my students have participated, and I've contributed a number of studies involving zoonoses. These are situations where pathogens span from the animal interface to the human, whether it's antibiotic resistance, such as studied by Cheryl Waldner over there, or whether it's cases where we see new emerging infections come into the human sphere, like MERS or SARS or HIV, which originally led for millennia, if not tens of thousands or more of years, in the animal realm. And we're united by global travel in a way that makes it increasingly easy for pathogens to skip from one area of the world to the next. We're also increasingly aware of the effects of critical periods in the life course and the long shadows cast by early life trauma, early life exposures on life course outcomes. So if we want to understand chronic disease in older age, it's been a sobering realization that much of it can be traced back to effects in early life. And if we really want to change things for the better, nudge those curves, having kind of a theory of how the world works that takes those linkages into account is really important. And we're also beset increasingly by a realization that intergenerational epigenetic effects shape health outcomes, and even exposures in utero can have a large impact over risks in the life course. And in many areas, we're also confronting more nimble corporate actors, whether in the area of tobacco or big food, pharmaceuticals. We're in some areas, such as tobacco control in the states, the authorities there's circles being run around them by tobacco companies who are much more nimble in terms of exploitation of social media and online forums, et cetera, compared to tobacco control. Now, traditional techniques have secured tremendous insights in these areas, whether it's randomized controlled trials or large-scale epi studies, very, very controlled pathway-specific laboratory studies, and statistical analyses documenting associations between risk factors and outcomes. And those are foundational sort of levels of understanding. But really, those techniques have been focused on what I would characterize as a reductionist strategy. And I don't say this as a point of opprobrium. It's just they are concerned with taking apart the pieces. You consider a clinical trial for a drug, and often you are controlling for, in the form of compliance, for example, some of the most important things that are going to affect whether or not it succeeds in the real world. You are controlling very carefully for people's backgrounds and their likelihood of continuing and their likelihood of recommending it or disrecommending it to others, which are things that may have a huge impact in communities. When we are considering, pathway-specific laboratory studies, often we are constructing environments, whether it's for animal studies or human studies, that are very, very fixed and controlled in a way that's very different from what's actually going to be encountered in the world. And in short, we're often taking apart the pieces of things and understanding those pieces without a clear understanding about how the understanding that comes from that fits back together to give an understanding of the whole. We're taking apart, we're understanding the pieces in isolation, but increasingly we are having a difficulty relating what we find in those small pieces to what we see at the meso level and macro level. You think about studies of the exact mechanisms of insulin resistance for diabetes, and surely that's related to the high burden of diabetes in our indigenous communities in Canada, but it can't simply be reduced to it, any more so than a traffic jam can be reduced to detailed understanding of how axles work and how tires are designed or how a road is bent. Increasingly, if we want to understand policy trade-offs and if we want to understand the implications of patterns we see in data, the understanding of the pieces is important, but we need something that puts it together. Making decisions is particularly going to be risky if we don't understand how the pieces that we affect with interventions are going to affect the whole. Some of those issues that I mentioned earlier, these tightly interrelated and causally tangled issues, for example, reasoning through these multifactorial diseases like diabetes and obesity, and rigorously assessing drivers for trends and patterns. For these sorts of undertakings, we have difficulties just relying on understanding about the pieces. Increasingly, we're also drawing attention to challenges on the implementation side of interventions. We can have a very well thought through intervention, but if it's not implemented well, rolled out in a sustainable, at-scale fashion, in a fashion that has the requisite human resources, et cetera, it's going to run into often problems. So, in a longer version of this talk, I go through different domains where, once again, starting with the biomedical understanding is a good start, but there's all these factors that end up influencing the picture when it comes to something like diabetes and obesity. And if we want to change things, we need to not only focus on these very basic physiological components, we need to focus on the environment. We need to understand the spread of norms, attitudes, and beliefs. We need to understand social support networks. Same thing for oral health, and oral health disparities, right? we have these layers of issues that often pile in and mediate the success or failure of interventions at a low level. So, these traditional reductionist strategies have got us a long distance and will continue to offer great value. They've offered enormous understanding of how the mechanisms work in isolation. But if we want to understand how those mechanisms combine to yield overall behavior, if we want to understand the emergent patterns we see in the world around us, these high-level patterns, we need to understand how they interact with each other to yield the behavior as a whole. And in general, scientists have come to realize over the past century, particularly, that often we're dealing with systems where the whole is greater than the sum of the parts, where we'll have a lot of pieces, but what we see for the system as a whole is not merely reducible to those pieces in isolation. It's not merely an average of those pieces or the sum up of those averages. The patterns that we see for the system as a whole, maybe it's very rapidly rising rates of diabetes, surely have some link with the low-level pathways, the low-level clinical insights, but they are not merely reducible to them. As I said, any more so than a traffic jam is reducible to purely things about axles or engine sizes or what have you. When we're trying to understand the success or failure of interventions, often that brings home the need to kind of reason about the system as a whole in a way that transcends what we could do with reductionist approaches. So broadly, I'd like to talk about two broad challenges that confront us increasingly in the world when we're trying to, as in teams, address large-scale health issues. One is the need to explain what's going on. We often will have a growing amount of data about things in the world, but we want to ask questions about it. For example, does the evidence support my hypothesis? Where's the situation likely to go next? What is driving these observed patterns? Is what I'm seeing sometimes, is it a good thing or is it a bad thing? Sometimes that's not obvious. And for centuries, people have noticed some of the puzzling patterns that come up. This is a graph from Bailey observing deaths from bubonic plague in London during the London plague outbreak. This is by week and the number of deaths on the x-axis. Now, you could have told Bailey at the time, and I'm sure he would have valued knowing that about how this infection was spread, and the role of fleas and rodents and so on in that. But this pattern that we see cannot be purely reduced to that knowledge. There's something else going on here that has to do with the social context of it, how it's spread, how it's reported, etc. And we know for childhood infectious diseases, some of the patterns that were observed historically here for pertussis in England and Wales, and then here for measles and mumps in Saskatchewan, they exhibit to what early observers were very puzzling patterns of kind of periodic outbreaks. Periodic outbreaks that, once again, couldn't seem to be directly reducible to what was known about the pathogen. It's not like this pathogen, was associated with a process that every few years it got a lot more pathogenic. Rather, what was observed here was an entangling of the features of the pathogen with features of the host, of the people who are subject to it and their levels of immunity and the births and introductions of new susceptible individuals into the population. That's what was associated with these patterns. It wasn't reducible purely to the pathogen, nor to features of the demographics of the population, nor to features of the immunological status, but rather an entangling between them. Some of our work is looking at the interaction of child and caregiver well-being, and the fact that, particularly in early infancy, there's this entangling of the emotional and affective, the affect associated with the child and the caregiver in a very profound way. In something like postpartum depression on the part of a mother, can lead to adverse child outcomes in the form of less response and developmental difficulties. Similarly, a child who has developmental difficulties can raise the risk of depression on the part of a mother. We're trying to understand health service delivery trends. These are from Saskatoon hospitals looking at emergency department length of stay in hours. And you'll notice that this is creeping up over time, right? This is the mean level. But then we have a 90th percentile that's far above the mean. And we have a median that is well below the mean, suggesting that maybe there's a long tail here. If we want to understand this, we start diving into other things, like look at the number of ED visits, the number of emergency department visits for different hospitals, or the percentage of hospital days that were estimated to be associated with alternative levels of care, where you have a patient occupying an acute care bed who doesn't need to be there for medical reasons, but maybe just doesn't have a place to go to. Maybe their family is not ready to take them back because of the need for respite. Maybe the nursing homes are all full and they can't get into them. If we want to understand why we see something like that, we start going down into areas like this. We start looking at hot-spotting results and, what fraction of patients take what level of care, the number of revisits on the part of the patients. And in short, we start trying to think about how all these pieces of this system fit together and to try to think through, why do we see these patterns? Why do we see these sort of rates of growth over the period of just a few years? Requires teasing out the interlinkages between the different components of the system in a rather intricate way. How do these pieces relate to each other? Could this be causing both of these observed phenomena, etc.? We also know the work of Christakis and Fowler highlighted from an associational standpoint the degree to which obesity, not merely pathogens, but also obesity, is associated with a sort of association that would appear to be contagion, in the sense that if one person's obese, their friends are much more likely to become obese than otherwise. And we know that there's big disparities in terms of the spatial patterning. For example, this is the sexually transmitted infection chlamydia within Regina, and you can see these big disparities associated with household income and correspondingly with the chlamydia rate. Colleagues of mine, Ann Jolly, PHAC, has documented the spread of chlamydia across networks in Manitoba. And with zoonoses like rabies, we see very distinctive spatial patterns, these kind of bullseye-type patterns as it spreads out. These patterns are structured. They're not random. I mean, this may have some elements that look random, but there's a lot of structure here. There's a lot of order to it. It's not merely random, but neither is it 100% predictable. They're very different from what we see in any one piece of the system. Those spikes within childhood infectious disease rates, again, are not merely reducible to the characteristics of the pathogen, not merely reducible to the immunological status associated with a person in the population, not merely reducible to the demographics of the population. It's an entangling of all of these at some level. And they reflect what we talk about as emergence, a situation where the behavior of the whole is different from, it transcends, it's greater than, in some sense, not merely reducible to the behavior of those pieces. We see something different at the neighborhood effect than we do within the family, than we do at the level of the individual, than we do perhaps for the region. And anticipating this emergent is really required both to understand what we're seeing. Why do we see these patterns? Requires reason about where these patterns come from. And then if we want to change something, if we want to put in place a new policy or new intervention that has a sustained positive effect, we need to understand something about where the emergence comes from. Otherwise, we may find out we're surprised by effects totally different than we expected, which dilute or defeat the intervention. if, in short, we want to create, as to use Jeff's memorable terms, as always, for it, we want to create fixes that stay fixed, we need to understand where this emergence comes from. And this brings me to my second point. If we want to intervene, if we want to know where to best intervene, which target group, which stage of the process, are we going to improve our screening? Are we going to improve our efforts to engage in prophylaxis against those found at high risk? Do we want to focus on treatment? Do we want to focus upstream on prevention? How do we best intervene? Which particular target groups? Think about H1N1. Should we be vaccinating pregnant women first, or healthcare workers, or the elderly, or those with adverse immunological state due to taking immunosuppressive drugs? If we want to ask how soon am I going to see effects from this intervention, or how could I scale it up? How could I take it from Moose Jaw and take it to Toronto, for example? If I want to engage in kind of careful planning through of that, we need to be able to reason about why we see these patterns emerging, these patterns that are not mere reducible to the pieces. If we want to make an implementation financially sustainable, to go from a situation, for example, where we use sugar-sweetened beverage taxes to pay for investments in physical activity infrastructure, we need to reason through how putting in place that tax might lower the use of sugar-sweetened beverages to make sure that the revenue sources will be sufficient to support the physical activity investments. We know for years the importance of bridging individual, for example, within networks, bringing infection from one community to another, and the importance of certain network cores for sustaining infection that otherwise would have died out. The fact that, in some sense, the tail wags the dog, that just a small portion of a population, maybe it's the frequent flyers in an STI clinic, maybe it's the frequent flyers who come to emergency rooms. Maybe it's individuals with large numbers of contact patterns due to risky sexual habits when it comes to STIs. Sometimes that group is the defining group. It's not just the behavior of the average. We have a situation where just a small group can make a disproportionate difference, keeping the infection circulating in the population where otherwise it would have gone extinct. And we want to be able to target that group, perhaps, in our interventions. In some cases, we try to focus our interventions on tipping points, situations where if we just invest enough, just invest a little bit more, it makes a qualitative difference. We see, a high-burden childhood infection disappear from the population, or we see a situation where the level of obesity in a community declines markedly. That's the hope in many cases. And with tipping points, we're dealing with an emergent phenomenon, something where it comes out of the complex interaction of the pieces of the system generally, and where if we want to make a night and day difference, we need to figure out how and why that tipping point exists, where it exists, so we can invest to realize it. Increasingly we are struggling to ameliorate the impacts of reinforcing feedback and path dependence, like this effect of early life insults on later life prospects, of children who are deprived of adequate nutrition early on, who grew up in environments of emotional deprivation or had adverse in utero exposure to diabetes, and we're trying to bend the curve later in life for that in a way that's sustainable. Now, when we're dealing with systems like this, with tipping points and emergence and features having to do with path dependence and lock-in, reinforcing and balancing feedbacks that might accelerate change or resist it, often we're dealing with real challenges to acting. There's counterintuitive behavior. It's easy to misperceive what's going on, to misinterpret the data, to take, for example, rising reported rates of an infection as a sign of an underlying epidemiological crisis when really it's the effect of better reporting. We might be in a situation where if we undertake an action, we dilute or defeat the the policy by virtue of the system's feedback structure. And these phenomena, in the presence of tipping points, pose real problems for learning from experience, learning from what worked in Vancouver and applying it to Regina, to coordinating different pieces of the system, and to planning and deciding and designing effective systems. In short, if we don't understand these patterns of emergence, we may end up sort of flopping around when trying to undertake these actions, trying to learn from experience, coordinate, planning, decide, and designing systems, where really we need something stronger than that. Fortunately, there's this emerging field of system science. It's been around for decades now in various forms, but it's really started within the past 10 years to make heavy forays into the health sciences. And I've been on the bleeding edge of that for now close to 20 years. And the observation here from the point of view of system sciences, those patterns that we see, these puzzling patterns that we went back and saw, you know, these patterns of the tail wagging the dog, these network structures, of these sort of spatial patterns, and these patterns of interlinked sections of a health service delivery network, or of these sort of patterns with childhood infectious disease, those don't emerge from nowhere. Those basically reflect emergent patterns from underlying processes. There's some underlying processes which give rise to those. And while we can study things statistically in terms of high-level associations, to really understand why we see those patterns and how those patterns would change if we change the system, we need to reason about these underlying processes. We need to reason from a statistical standpoint about the latent variables that are driving the system. Okay? And absent this, we risk working at cross purposes with the nature of things. If we don't understand why those patterns are coming up, we may end up shooting ourselves in the foot by trying to fix them in the wrong way. So system science is the science of the whole that seeks to help us visualize, understand, and reason about, and increasingly manage understanding regarding these underlying processes, and to test the consistency of our understanding of the world with evidence. And a central way in which system science aids us, not the only way, but a central way is with dynamic models, simulation models. They go by many names, as we'll see. And these models basically weave together a representation of our theories of the world in a way that allows us to ask what's the logical implication of those theories and ask what-if questions. Okay? They capture our kind of theories of how things might work out there. And by so doing, they serve as thinking tools, laboratories for refining thinking, spotting oversights on our part, spotting inconsistencies, more quickly, in short, identifying errors in our thinking. And they allow us to share our assumptions with others. Now, this is a slide that I'm going to be featuring through much of the day, much of the afternoon. These are features that if people see them in the problems they're struggling with, it points to the potential advantages of applying a system science approach. I'm going to be coming back to this later in the day, and many of these are things I've just mentioned. The presence of emergence, these high-level patterns which can't be reduced to low-level features, feedback, path dependence, very different effects at different scales. The presence of long delays, for example, or adaptation on the part of the system. Think emergence of drug resistance, for example. Let's talk about these dynamic models. We saw one this morning earlier. So simulation models represent these hypothesized causal relationships. These dynamic models capture these hypothesized relationships that we think might be applying out there in the world, or whose implications we just want to think through. And they provide a way to examine the diverse system-wide consequences of our assumptions. Okay? They allow us to kind of create this little micro-world where we say, suppose it worked like this. What would the implications of that be? And then we can test this consistency with our empirical data and understand if it seems to match what the implications are for potential choices we might have. So these models help us understand system vulnerabilities and leverage points, places where we can really make a difference or where it's vulnerable, places we could change the system structure, improve ways of working together. Now, one of the confusions in this area is they go by very different names. You will hear these models called very different things in different subsets of literature. Mathematical models, causal models, mechanistic models, models of the physics of the system, compartmental models, agent-based models, discrete event models, system dynamics models. They're all types of dynamic models, okay? You will hear them go by different names, but they share certain characteristics. They're models that, by and large, are going to depict hypothesized causal structure of a system, or of a little sort of alternative system you may want to depict. They're mechanistic in the sense that they depict kind of how things work in the system and in greater detail or less detail, but sort of what causes what within the system. In that sense, they're causal models, not in the sense of a path analytic model, causal model in statistics, but in the sense of what variables causally impact another variable, in the sense that a change in one leads to it to influence the values of others. And they simulate the step-by-step evolution of states of a system in the external world. Okay? And because they seek to capture causality, what changes what in the world, they help us think through the implications of counterfactual situations we've never encountered before, but help us think through, if we were to see this situation, what would the implications be? Now, what are the general sort of elements of the model? Well, regardless of whether it's an ABM, a discrete event model, or system dynamics model, we're talking about a situation where we depict an initial state of the model. We specify an initial state. We specify rules indicating how that state changes based on the current state. So given where you're at now, how is it going to change in coming days, weeks, minutes, or what have you, depending on the scale of the model? So depending on the current state, how is that going to lead to changes down the road? And as we'll see, the three types of modeling that we're going to be looking at provide different ways of characterizing these transitions, but they base it on the current state. Okay? From such a specification, the initial state in these rules, the system can map out by chunking through over time the state of the system as it evolves over time. So we have this kind of micro world, and we could say, okay, simulate it now over time. We saw that earlier with that model, right? We could run it, and it would tell us what the implications are over time, and it created those association plots, etc. Okay, so it's depicting the behavior of the system over time. There's some evolving situation of the system, evolving state of the system that describes its current situation. And the model specified these incremental change. The system behavior is not something you can write down ahead of time. It's not like you can write down that it varies as e to the minus alpha, alpha t plus beta times t squared or something like that. Instead, what we're seeing is a situation where the behavior that emerges from the system can't be reduced merely to any one piece. And you can't write down, in general, for these systems, these nonlinear systems, a solution. Rather, you have to simulate it over time. You have to have the computer solve it. You have to have the computer, play out what its consequences are. It can't be specified in what we call closed form, in other words, with a formula. Okay. And that's in contrast to things like Markov models, where it is, in many, many cases, possible to write down a closed form solution for it. It may help you think through interactions, but fundamentally there is a specification that is you can write down a formula for how it will evolve. And generally, because the systems exhibit nonlinear models, generally the models are nonlinear as well. I'm not going to come back to that, but it has great implications for the ability to sort of reason through system behavior, emergence, etc. Okay, the analogy here is that I like to use in the health area is that, for many other domains of activity, people have for decades been using these sort of simulations. If you're flying in a plane, if you were flying here from another city, you would probably never have wanted to undertake that flight if the pilot hadn't been trained on a simulator in all sorts of weather conditions. It's unthinkable that you could have someone piloting, you know, a 777 or any major plane without having gone through extensive flight simulation training of how to fly in a, near a thunderstorm, how to fly in the context of hail outside, how to fly in high winds. That's viewed as such a fundamental level of training that it would be unthinkable for someone to start flying commercially without that training. Similarly, when people run power plants, there's plant simulators the operators are trained on. With drivers, high schools run vehicular simulators. And when people do design of streets and traffic flow, there's traffic flow simulators that are used. It's just in the health area, these are rather newer constructs. They don't have as long a history, but they are viewed as essential to making reliable decisions in many other areas of modern society. So I'd like to come back again as a defining feature of, I think, the viewpoint of this boot camp and of my use of models is this idea of models as thinking prostheses. And I want to come back because I think it's so fundamental to modeling. There's this prevalent view out there of models. It extends to the health area. The models are kind of a crystal ball. That we capture in them all this expert knowledge, and it better be expert. We better, spend years getting it right, and then we use them to project forward what's going to happen. And if there's some big inconsistency noted, it's a sign that the model is flawed. Maybe it's a sign the modeling project has failed because it's failed to sort of characterize the truth of the situation, and the model is put aside. I think that's a grave mistake to make with modeling, particularly in the context of the types of modeling software we're using here, which can be transparent to a team and which can help a team learn much more effectively. Models are best used as learning tools, as learning prostheses, in Jeff's immortal words. They help us learn more quickly, reliably, deeply about the world by helping us think through the implications of our assumptions. Remember that first model we ran, right? That model which I had up there, which depicted people's food procurement and their eating choices and their impact of parks on their physical activity and what they ate on their weight as well. And it was all tangled together. Models help us understand the logical consequences of that by running them completely consistently. That's what computers are good at. Computers are horrible about a lot of things. One of the things they're good at is doing simple, dumb things quickly. And one of these dumb things is to kind of simulate out the consequences of a theory that's articulated precisely. And by so doing, by helping us simulate this out, they can help us spot inconsistencies between what the model posits, what the model represents, what the model is theorizing, on the one hand, versus what empirical evidence suggests. We can spot more quickly than if we had our theory in our head when there's a fly in the ointment, when there's a problem in our theory. There's an inconsistency between what we think is the case, what we think might be going on out there, and what's actually observed. And by helping us to spot those inconsistencies, that's when models can be most valuable. They help us to spot the flaws in our thinking. And as such, the model is going to fail in the sense that it's going to not match the observed empirical evidence, perhaps, not match our experience when we launched the intervention of what we expected. Ladies and gentlemen, that's not a failure of a modeling project. That's a success of learning. If we learn that, okay, so how I was thinking about the world was actually off base in this way. I need to refine my thinking of how this part of the process works. In short, it allowed us to discover a latent problem in our thinking that otherwise wouldn't have come to the fore. And this can allow us to then inform our choices once we have a model in which we have some degree of confidence and advance our understanding. Okay. The comment here from Francis Bacon, I'll come back in just a second. The quote from Francis Bacon that I just love. Jeff is a source of remarkable erudition, and this was something that he identified, which is wonderful. This is from 1620, and Francis Bacon commented, "Truth will sooner come out of error than from confusion." And that may sound, outrageous. That what you mean by being wrong somehow is better than being confused? Well, the point is, basically, this is their version of fail early, fail often. Try something, and if you're wrong, you learn from it. Whereas just being kind of muddled and confused in a way that's not precise doesn't get you anywhere. At least by trying something, you can observe whether it's consistent with what's out there. And that requires a comfort with failing in the sense of identifying an inconsistency. Another way we talk about is nothing ventured, nothing gained, right? If you don't try something, if you don't put forward some theory that can be precisely specified and explore the implications of that, you will find that certain inconsistencies in your thinking will remain hidden unless you make it explicit. Yes, Scott.
I just wanted to add on to what you're saying about the flawed theory of models and crystal balls. Just for full disclosure, I own my own consulting firm that does simulation models for clients for money, and all domains, not just health. And I've done over 24 projects in the last 2 years, and every single one of them wanted me to create a crystal ball, without exception. They're like, we understand this process, they didn't, and we want to build models so that we can say what's going to happen if we do X. And I go from the model, like, it's not working. I'm like, well, then tell me something wrong. It's very clear that these people, they want to use it to justify what they're doing, not to learn what they should do. Okay? And that's a very big issue. Now, I will say, actually, one of my clients, while they're still in that mode, they're using the models to find out something that they don't know about. And it's basically they're looking at system architecture, and so they are looking at, we don't know the impact if you do something here is in the supply chain. What are the impacts here? Okay, the model that I built for them is the only thing they have that actually lets them even look at that a little bit. Okay, they know that these things sort of happen, but they don't know. So they are using it for learning outcomes, but it's still the overwhelming view of simulation models in the industry is these are crystal balls. Okay, and that's something that we really need to tackle at some point. I think it has to do a lot with the fact that my discipline, industrial engineering, that's what they kind of teach in school, actually.
Yeah.
Is you build models to figure out answering questions you can't answer in a way. And I think we need to learn.
Yeah, and the key thing is, so thanks, Scott, it's a big loss of opportunity. And really, for the people here, probably 70% of the people here who have signed up are never going to be, the foremost modeler on a project. And that's okay. You will work alongside modelers. And the prospect here is of using models as a tool for that team to learn more quickly. Okay, and it's all the people in the team have some awareness of what's going on in the model, can run it, can appreciate the assumptions in it, and can reason through basically what it's representing, and then by running it and by comparing observations from the world with what's in the model, and ideally by undertaking interventions that are guided by the model and comparing the results against the model, you can refine your understanding of the degree to which the model is consistent with the evidence, and by extension, the degree to which your thinking about the situation in the world is consistent with the evidence in a way that advances group learning. It's a tool, in short, for faster learning. And regardless of whether you're a big lean proponent or a skeptic of lean, or regardless of whether you believe in continuous improvement methodology, is whether how fundamental it is to the success of a healthcare system. There's something about the idea of continuous learning and being able to learn more effectively that's very powerful and I think very significant. And models do provide a learning tool that can be a formidable asset that goes beyond the model and extends to the modeling process. It extends to what you get out of the modeling process. It's a lot more than the model as an artifact. It's better thinking. So here, I think models provide a way of identifying more quickly if we're wrong, rather than being sort of perpetually confused. Now, that being said, there's many uses of these models. One of the most basic uses is to make explicit my theory of the situation so that you can understand it. So taking my understanding out of my head, putting it in an explicit form which you can look at and critique, in which we can refine together. We can modify it together. I talked about aiding learning faster and more deeply from evidence, faster, more deeply, and more robustly. But they can also critically assist in the management of complex situations. They can serve as what-if tools for identifying desirable policies. So if we have some confidence that what this model is capturing is an adequate characterization of what we see out there, or if we just want to think, if we make these simple assumptions about the system, what does that imply about interventions? They can be incredibly effective tools. This can look at cost-effectiveness trade-offs, identifying interventions that are robust given the uncertainties that are observed. There may be big uncertainties. That's not a reason not to model. In fact, it makes models even more valuable. If there's big uncertainties, a model can help you identify which of those uncertainties matter the most and can help you prioritize data collection for those specific uncertainties. Often we're beset in health by big uncertainties, particularly in certain areas. What's going on in the community? What's actually in fact going on in certain service delivery networks versus what's going on in theory or what have you. And some of those uncertainties, it turns out, at a mathematical level make a bigger impact than others. And using a model, we can test that. We can test the degree to which uncertainty of one area of the model can affects the results compared to uncertainty in another. And what you find is with nonlinear models, some things, 10% uncertainty matters a huge amount, and sometimes it matters very little. It's a feature of the nonlinearity of the system. We'll see how we can do that in any logic. It's a thing called sensitivity analysis, and we'll see ways we can undertake that. Models can help us, therefore, prioritize data collection, identify key uncertainties. They can also help us identify reasons for trends that we might see, or help explain, posit plausible explanations for trends that we see, or evaluate the benefits of restructuring the system. And finally, they can help with communication, communicating to non-experts, to people who might not even be, might not be trained in any of the health sciences, might be members of the population, can help them understand at a broad level some of the trade-offs between policies. Okay, the analogy here I like to use is that models are like maps. Like maps, models represent abstractions of the world around us. A map is kind of a simplified representation of the world. And it's the capacity to omit details that makes that map useful. If you're in LA and you want to drive across the city, you're going to want a map that omits a lot of the details of what's in LA. You don't see the stars walking around on that map. You don't see all the details of the boulevards. But it has enough details to allow you to be useful and yet manageable. And so it is with models. But like maps, models are specific to purpose. If you want to drive through LA, you're going to want a very different map than if you want to take the public transit system through LA. Or in turn, if you want to understand why flooding is coming in the Santa Anas in LA, or why we see brownouts at certain times of the summer in LA. Those are different maps that are each appropriate. Electrical connectivity map, topographic map showing transit ways, etc. And so it is with models. And this is going to be a key thing this afternoon, is figuring out the scope of our model. What things are in there, what things are left out. This is a particularly central, big, recurrent strength and danger of agent-based modeling. The type of modeling we're going to be learning here is incredibly powerful. It's incredibly flexible. You can do lots of things with it. But simultaneously, it's danger, because it's so flexible that it's easy to get yourself in a situation where you build a model that is far too complex for you to handle. So we need to clearly delineate what to include in the model, and to change that over time, starting with very, very simple models and adding in as we learn, and choosing what to add next based on that learning. Now, which details we omit in this model, what we leave out, is often key. Jeff talks with me about my boot camps. The choice for my boot camps being, which 90% do I leave out this time? And so it is with models, except it's not 90%. It's like 99%, something like that. We need to leave things out of the model for it to be manageable, to learn from it more quickly. And we need to do so in a way that's adaptive and evolving over time. We add things into it. So models like maps are wrong in the George Box sense. You know, George Box, the famous statistician, wrote that all models are wrong, some are useful. And so it is with maps, right? A map is wrong. It's not a perfect representation of the world. The only perfect representation of the world is the world itself. Maps, you could say, are wrong, although I think it's an uncharitable way to characterize it. The question is it an appropriate and useful approximation, and useful enough for your area that it does a good job? It's not merely they're all blanket wrong, but some may be appropriate to fit for use. Now, with a model, it's a bit more difficult to ascertain a priori what information should be omitted. And this afternoon, we're going to be going through some discussion of this. So a common concern here is scoping the model, setting the boundaries of the model. What quantities are generated by? There are three basic categories here. And I'm going to this afternoon ask you to delineate these for your projects. Which quantities are generated by the model? So we saw that in that first model that we built, didn't we? We saw that there were certain quantities in it. I don't know if you remember, but when I ran this model, I think some of you are running it, judging by what I see in the audience. Sometimes I see people running something, which is great. Remember the unconference. So here we go. We're going to go down, and we're going to go down. Well, we can see right here, a person's location. You can see people moving on these thoroughfares here. See them? They're moving around. There they go. Oh, they're going to the store. And you could see that that's a feature which is endogenous. It's produced by the model. Their location at any one time is something that the model produces. But more than that, if we go down to each population member, we can see the number of convenience store meals that they have on hand in their larder, and the number of supermarket meals. At any one time, it is producing their weight, right? Their weight is evolving. It is generating that. It is generating the number of meals that they have. It is generating in what state they're currently located. These are all things that the model produces. Who eats what? These are what we call endogenous. They're produced by the model. The model tells it to us. It's part of the model output. You could put it in different ways. By contrast, there's a set of quantities in the model which are specified to the model in a fixed way, a pre-specified way. I shouldn't say always fixed. It may change over time. But the point is it's pre-specified. So you may specify, for example, how over time you want the unemployment rate to be assumed to vary in your model. In this case, we have some things specified to the model. Can anyone come up with, judging by this? What's something that's specified to this model? location of stores, location of parks. That's all specified to this model. We tell the model, okay, assume this location of stores and parks. Now, go figure, right? That's kind of what's involved here. That's something that's called exogenous, okay? Another thing that's specified at an individual level is each person's predilection for the floaters, the convenience store food, right? This right here, the preference for convenience store meals. Each person is being given a different level of preference, but it's pre-specified. Okay? Thou shalt have this preference, thou shalt have that one. Now, in an expansion of the model later, we could make it endogenous. We could have it depend on their history of food, what they ate as a kid, what their family eats. We could have it be affected by social norms. But for now, it's exogenous. It's not generated by the model. The model doesn't tell it to us. We tell it to the model, the exogenous things, okay? Those are exogenous. We're told to the model in a pre-specified way. And then there are some things that are omitted by the model, that are simply ignored by the model. And often they are consciously omitted. We say, for this model, we're going to exclude effects of social norms. We're going to exclude effects associated with different access to transportation. We're going to say, we're going to exclude a consideration of the opening times and closing times of grocery stores versus convenience stores. These are things that are ignored in the model. They're often consciously omitted. It's good if they're consciously omitted. Now, later, as the model evolves, we may change this division. It may evolve in significant ways. Things that are exogenous, maybe it's my predilection for my hankering for convenience store meals, that maybe gets something we want to consider endogenous over time. We find it's highly sensitive to that, so we say, let's experiment with making it endogenous in a certain way. That would be an example of how a model might evolve over time. But at any one time, you want to be very clear when you delineate your model which category is it. And at first, there's going to be very, very few of these things, just a couple key hooks. And you're going to have some exogenous things, a lot of omitted things. And that will let you learn more quickly from that model. And then you can evolve it, not based on your presupposition of what will be useful, but based on your actual experience of what it's sensitive to and the interesting patterns that you've seen. In short, it'll be a more informed evolution. Scott, were you going to say something?
I was just wondering, how would you, like, for example, you mentioned how can we get to and from stores, like us in the car going a little distance, we're not modeling that, I thought it's important. But you could make the argument that the likelihood you're going to eat one versus another is as part of transportation. For example, if you don't own a car, you have to buy a lot of groceries at the grocery store because space and what. What I'm saying is that what happens if you have one variable that actually sort of serves as a proxy for others? Like, there's a lot that goes into what type of food you're going to eat. Mm-hmm. Do you note that? Like, how would you note that in this sort of, like, straightforward idea?
Well, that's a very common thing here that you're going to start with a model and say, look, we're going to assume that we're studying a population where they all have similar access to transportation, and that's going to be an assumed feature of our model, and that is well accepted as a component of sort of stylized modeling in health. And these are the sort of models that Amber will have heard me talk about with Ross Hammond and with Elizabeth Brooke, that you start with very, very simple models, and often you can learn a lot from simple models. And then you will start to elaborate it, perhaps, but in a way that's more savvy because you've learned from the very simple start. Rather than starting with a plan for a very complex model, working a long time, putting it in place, and you haven't benefited from the learning along the way, you haven't benefited from an understanding of when you added which particular thing did you start to see that pattern or this other pattern. You won't have learned from the debugging. You can learn to spot the errors more quickly along the way. There's a lot of reasons for kind of rolling it out in a step-by-step fashion. So in this case, we're abstracting away from the issue of transportation choice. We might find that the distance is very sensitive to our assumptions about the likelihood of buying one or the other. In this model, we consider distance as well as predilection for food. And so, we might decide, okay, based on that sensitivity, adding that in would be a worthwhile endeavor. We'll start with, a fraction of the people